This is Dr. Anthony Chang from Southern California on the COVID-19 and artificial intelligence video series, How Pandemics Will Be Eradicated in the Future. This is the fourth of a five-part series of videos on COVID-19 and artificial intelligence. So in this fourth segment, we'll be talking about lessons learned during this pandemic and for us to learn in the future as well. So this is lessons learned from COVID-19 and artificial intelligence. So I think from a global health perspective, I think the first lesson, as painful as it is now, especially in the United States, is that early mass testing for the infection and the organization of this data into a database really needs to be accurate, complete, proactive for successful containment strategy. So essentially, in the US particularly, we lost a 1 month window to decrease the number of fatalities because of lack of adequate testing. And we hear about the flattening of the curve often, but again, as I mentioned in the third video, that it's a misconception if mitigation alone sometimes will flatten this curve. Oftentimes, you would need more stringent measures that would be part of the suppression strategy, although nobody likes that word suppression. So essentially, some of the mitigation measures are technically under the suppression category. But whatever we need to do to flatten the curve is what most public health officials would like us to do. So again, the more proactive one is about mass testing, and the smarter one is about data and its organization, the less likely you're going to need severe interventional measures for a long time. So this is essentially data showing you the flattening of this curve. China, as you can see, is reporting practically no new cases within China, but cases now are imported. And whereas if you look at the United States, we're still not seeing the flattening of the curve, and hopefully we will see that soon. Other countries like South Korea, Japan have already reached that plateau. And sadly, Italy is hopefully starting to see that flattening in the next few days. I think a second lesson is that we really need more sophisticated continual disease predictive modeling for real-time accurate information, predict how we're going to allocate resources and how we minimize mortality. You see examples of machine learning, but I think given that there's so many nuances for each country and even each region in this infectious disease, that I think each region ought to have its own deep learning or deep reinforcement learning specifically model to really predict the number of deaths based on different scenarios and how to allocate resources. I think the third lesson that we're going to learn from this is that the therapeutic interventions, especially if public health measures have failed to some extent and failed to make impact, really the interventions really need to be both innovative as well as expedient. My heart sinks when I hear solutions in the therapeutic side that will take 12 to 18 months. I think the viruses are acting exponentially in terms of infecting the population. We need to have a congruent strategy that's exponential rather than linear to deal with these viruses. And this is already the 3D rendering of the virus SARS-CoV-2 that is already available online. So I think very importantly, we need to disrupt the traditional approach of multiple phases of a drug or vaccine trial and really try to bend the trajectory of these trials from linear that you can see here in a typical clinical trial phases 1 through 4 and make the trajectory exponential and this is we're losing lives by not having this be exponential. In addition, we need to have an open, international, multidisciplinary, collaborative effort in this area. So this concludes the fourth video on COVID-19 and artificial intelligence. I encourage you to look at the previous 3 videos, as well as the upcoming video that will talk about the future of artificial intelligence and eradicating pandemics.